Hello everybody, I'm Shobhika Jaju, psychologist and founder of Silver Linings Guidance and Counseling Center, Margao. Today I would like to talk to you about anxiety. And when we talk about anxiety from the mental health perspective, there are different kinds of anxieties that we acknowledge. However, today I would like to talk to you about generalized anxiety. Generalized anxiety or generalized anxiety disorder refers to the condition where an individual tends to worry excessively about something which is likely to happen, or so we think. So we are essentially talking about an apprehensive expectation. The expectation that something we fear is going to happen, and whatever that is also likely to be negative. So for those of us who may experience generalized anxiety, some of the symptoms that are commonly seen are restlessness, sleep issues, irritability, being keyed up or on the edge, forgetfulness. In fact, quite a few of my clients have reported constantly feeling that something is going to go wrong. Now, anxiety or excessive worry plays out very differently amongst different people. For some, it interferes with their work, for some with their personal life. However, in cases of generalized anxiety, we do find that there is a general level of interference in all aspects of daily functioning. There's that constant nagging sense that something is about to happen and that something will definitely be negative. And mind you that this is an apprehension, an apprehensive expectation, meaning it's an assumption. So you are letting an assumption about what's going to happen in the future affect your present. These assumptions could be inspired by past experiences of one's own selves or what we have heard or read about from people around us. However, at the end of the day, it still remains an assumption. Now the big question is that what do we do about it? Most importantly, it is evident that we need to acknowledge what is it that you are anxious about. What do you think is going to happen in the future? For example, let's say right now, many people are experiencing COVID-related anxiety. So, one example of a COVID-related anxiety could be somebody being on the edge about contracting the infectious disease. Now, the question is that it is still in the future. So, one way to deal with that anxiety would be to ask yourself the question, what can I do about it right now in this very moment? What is within my control about what I think is going to happen? For instance, in this example, it could be following all hygiene protocols, looking after yourself, looking after your loved ones. But some other things like how are others behaving around you, whether they are following hygiene protocols or not, may be a bit upsetting, but worrying about that is not going to help. So just to summarize that, the big question is what can I do about what I am worrying about, which I think is likely to happen in the future. I know that's a lot of words and a continuous stream of thoughts there, but that is one very effective way of dealing with any kind of anxiety. Anxiety, as I already said, is about something that you think is going to happen, which in most cases usually doesn't happen. And anyways, it's in the future, right? So how does that matter? Then there are some other things, for example, that you can take care or do to take care of your anxiety in the short term. For example, self-care, sleeping, trying to sleep well, meditating, eating properly, trying and exercising, reading, spending time with loved ones. So these are some short-term recovery points to deal with your anxiety. But in the long term, the big question is, what is it that you're very anxious about and what can you do about it in this very moment? So I hope that with this little small video, you have some clarity about what anxiety really is. And for more details, you can always contact me. Thank you so much for listening.